Microbial diseases of the genitourinary system. So this is urinary system and your reproductive system diseases. The genitourinary system is divided into two main parts. The urinary tract is going to include the kidneys, the ureters, the bladder, and the urethra. The reproductive system can also be known as the genital system, although I've never heard it called that, just so you know. The structures of the reproductive system will differ between males and females. I don't think that's a big 411 to anybody. Key parts to the male reproductive system are going to include the testes that produce sperm and testosterone, the epididymis, which is the maturation site and storage facility for sperm, the vas deferens, which is the tube that exports the sperm to the urethra, and the prostate. The prostate actually contributes fluid to the semen that is going to be expelled. The key parts of the female reproductive system include the uterus, which is where the fertilized egg develops, the fallopian tubes, which can also be called the uterine tubes, and the oviducts. All the same thing, just different names, because we have to be complicated or fancy or whatever you want to call it. This is the path, so this is the path, this tube right here, that the egg uses to travel from the ovary, which is here, this little almond-shaped thing, to the actual uterus itself. The vagina is the duct leading out of the female reproductive system, and the cervix, which is the opening to the uterus. So the defenses. The urinary tract flushing action of pushing urine out is actually going to be a defense. We mentioned this previously. The fact that you're expelling fluid means that if there's anything in that entrance, the urethra, it gets flushed out every time you urinate. The acidic environment of the urine itself. We do have antibacterial proteins in the urine itself, lysosome and lactoferrin. Lactoferrin keeps iron out of the hands of the bacteria. Lysosome breaks things. Lys means to break. In the female reproductive system, there is an acidic pH in the general area. We do also have the IgA in the secretions. Mucus secretions are present, and the normal biota. Again, this land is mine, you can't have it. For the male reproductive system, pretty much it's going to be the same defenses as the urinary tract, because for the male, the urethra serves both purposes. In the urinary tract, it is an exit for the urine. In the reproductive system, it is an exit for the semen. Microbial diseases of the genitourinary tract. Well, we have urinary tract infections, or UTIs, gonorrhea, chlamydia, vaginitis, also known as vaginosis, syphilis, genital herpes, and the human papillomavirus, HPV. Urinary tract infections. These are not transmitted. Generally, it's just movement of microbes from the GI tract to the urinary tract. They do occur in both men and women, but they are more common in women just because of the anatomy of that area. For all the ladies that are listening and the men who have daughters or plan on having them. For the female anatomy, you have the opening of the urethra at the front and the anus at the back. Ultimately, what that means is if you are wiping after going to the restroom and you're going from back to front, you're actually dragging the bacteria from the fecal material up toward the urethra. This is the most common way that we see this type of infection happen. Men do not have that issue because men, the opening is a lot further away. You don't necessarily have to worry about that dragging motion. Because of that, as little girls, most of us learn that when you wipe, you always wipe front to back. You never go the opposite direction. And this is why. I don't want my daughter to end up with a UTI if I can avoid it. So when you teach them how to wipe, you teach them to wipe front to back, not the opposite direction. The most common type of nosocomial infection are urinary tracts. And because of the fact that it's a nosocomial infection, you're usually catheterized. It doesn't matter whether it's male or female. It is still the most common that you see in hospital settings. With signs and symptoms, you have two varieties. If it's just the bladder that is infected, this is cystitis. But if the infection has gone from the bladder up to the kidneys at the top, this is going to be pyelonephritis. So with cystitis, like I said, the infection of the bladder, the symptoms include pain. It includes frequent urges to urinate. It includes a burning pain during urination. It feels like you're peeing fire. Dysuria is what that's called. And usually, because there's infection there, you get cloudiness in the urine. With pyelonephritis, like I said, that's infection in the kidney and in the bladder. The symptoms are this plus back pain and a very high fever. As a child, I actually did have a kidney infection. I think I was in first grade or kinder, one of those. My temperatures basically went up to 105, and at 105, they put you in an ice bath, and it wasn't fun. But that fever is a huge indicator that it's gone past your bladder. Causative agent. It's generally caused by the normal biota of the GI tract. Like I said, that dragging motion, E. coli is the most common cause. It's pretty much 80% of the cases that you see. Proteus mirabilis is another causative agent that is seen. But again, if you're talking about the most common, it's E. coli. Pathogenesis. The microbes enter the urinary tract through the urethra and an infection moves upwards into the bladder. And again, depending, it can also go up to the kidneys. One of the most common things that we do as adults is we don't go pee. Now, our bladder is designed so that when it fills up, it kind of goes up in its inflation. When it does that, it seals off the tubes that are coming from the kidneys. We don't go to the bathroom. When we do that, the bladder continues to expand and those tubes reopen, and that allows a gateway to get up to the kidneys at the top. Treatment. Antibiotics are going to work great for any type of bacterial infection. Phenazopyridine is actually something else that we can give to relieve the symptoms. It's not going to treat the disease, but it'll help with relieving the symptoms. If we're talking about getting this by yourself, you got to take care with your personal hygiene. Especially if you're a female, you want to make sure you're wiping the right way. However, if we're talking about in hospitals, that kind of lies in the nurses and doctors' hands. They need to practice aseptic technique, especially when you're catheterizing a patient. It's not necessarily just that maybe the catheter is contaminated. It could be that aseptic technique wasn't followed. So this is E. coli, this is Proteus mirabili, AZO, that's the phenazopyridine. This is going to relieve the symptoms, like I said. Pyelonephritis, the kidney infection. You usually have flank pain, a high fever, malaise, white blood cells, and bacteria in the urine, and urinary symptoms similar to cystitis. These tubes right here, these ureters, when your bladder is somewhat full, like I said, it kind of kinks back and it kinks the ends of these tubes so nothing can go backwards. When you let your bladder overfill, though, it opens these tubes back up. If bacteria has made it from your urethra up into your bladder, and now you've got these tubes open, all they have to do is travel up to get to the kidneys. Cystitis, I said this before, that's just the bladder by itself. You've got increased urinary frequency, an urgency to urinate. You feel like you have to go right now. Dysuria, which is painful urination. Pain above the pubic region. White blood cells and bacteria in the urine. And again, it is more common in women just because of our anatomical structure. Gonorrhea, one of the most common sexually transmitted infections worldwide. Transmission can be effectively prevented by using condoms. And you're going to hear that phrase a lot. Use condoms. It can be passed to babies who are born to infected mothers via vaginal delivery. It can cause an eye infection to that child. So signs and symptoms. In males, you're going to have painful urination, a yellowish discharge from the urethra, but some cases are asymptomatic. They don't even know they have it because they're not experiencing painful urination or a yellowish discharge. In females, again, some cases are asymptomatic. But if you do have symptoms, there's mucopurulent containing mucus and pus, or bloody vaginal discharge, painful urination. Progressive cases can cause, in females, some cases, just like in males, are asymptomatic. They never know they have it. But if we do have symptoms, there can be mucopurulent or bloody vaginal discharge. Mucopurulent means that it has mucus and pus, not just blood. There can be painful urination. In progressive cases, if you let it go for too long, it can cause salpingitis, which is inflammation of the fallopian tubes. It can also cause pelvic inflammatory disease, which is the inflammation of not only the uterus, but also the fallopian tubes. Neisseria gonorrhoeae is the causative agent. It is a gram-negative diplococcus. It uses Fimbriae for attachment and antigenic variation to avoid the immune system. So again, I'm changing the antigen so the immune system can't find me. Bacteria attaches at the infection site and it begins to grow and it causes the infection. It can spread to other parts of the reproductive system if left unchecked. That's what this is. Treatment. Antibiotics. Okay, so this is another one of those that antibiotics has worked for a really long time, but more recently, we're seeing antibiotic-resistant variants of gonorrhea. Prevention, use a condom. Observe safe sex practices. So this is Neisseria gonorrhoeae. Abdominal pain or pain with intercourse for females, vaginal discharge with bleeding. In males, you can see infected kidneys, urinary tract infection, burning sensation with urination, inflammation of the penile, swollen testicles, discharge from the penis. You have to remember that with men, it's not just the reproductive system that's isolated. Now you've got the urinary system also involved because they join together at the urethra. If you leave it untreated, you can actually develop arthritis, again with the pelvic inflammatory disease, where you've got the uterus and the ovaries and the fallopian tubes all inflaming. You can also have gonococcal pharyngitis or tonsillitis. I'm not trying to be gross, I swear, but it can pass from the genitals to the mouth under the right circumstances. Urethritis is another thing where you have inflammation of the urethra itself, the tube. Urethritis is going to be inflammation of the urethra, and it actually does cause painful urination. Chlamydia. It is the most common reportable infectious disease in the United States. For signs and symptoms, in males, we're talking about inflammation of the urethra accompanied by painful urination as well as discharge. In females, the majority of cases of chlamydia are actually asymptomatic, but it can lead to PID if it is not treated. So PID, remember, is pelvic inflammatory disease here. The thing about PID, if it's left untreated long enough, it can actually lead to infertility for these women. What is the causative agent? Chlamydia trachomatis. It's very small. It is also an intracellular parasite, so it goes inside your cells. It has to live inside of your cells. It will not survive if it's outside of those cells. The bacteria enters the body through the reproductive system. It invades the host cells, pretty much hiding out from our immune system. Again, if it's inside our cells and it's not necessarily doing anything, it's not releasing any foreign protein, our immune system will never realize it's there. Treatment. Annual screening to ensure cases are diagnosed and treated early. Treatment is microlide antibiotics. Prevention. Use a condom. That's what chlamydia looks like. Symptoms, common in men and women, in women only, in men only. So you can see the female and male symbol here. So this is in both. Painful urination with burning. Female only, lower abdominal pain. Female only, vaginal discharge. Female only, painful sexual intercourse. Female only, bleeding between periods. Female only, bleeding after sex. Both female and male, rectal pain and discharge or bleeding. Male and female, inflammation or infection in the eye. Again, it can transfer from one place to another depending on what your sexual activity is. male and female, persistent sore throat, female, lower back pain, female, fever, female, nausea, male, testicular swelling, tenderness, or pain, male, cloudy, milky, yellow, white, or thick discharge from the penis, male, redness, itching, and swelling at the opening of the urethra. Vaginitis or vaginosis. It's a general condition that can be caused by a variety of agents. It's fairly common in women and is usually not very serious. So vaginitis is inflammation of the vagina. It's accompanied by vaginal itching, burning, and a discharge. It varies depending on the agent, like I said. If it's C. albicans, usually you'll have a white discharge. If it's T. vaginalis, then it's usually a greenish, foul-smelling discharge. Vaginosis is an infection of the vagina with the absence of inflammation. The discharge in this case usually has a fishy odor and itching. Those are the two common symptoms you see with vaginosis. So Candida albicans, C. albicans that I mentioned down here, is the most frequent cause of vaginitis. It's caused by an imbalance in the normal flora. When women get put on antibiotics and the bacteria that are normally there die off because of the antibiotic, you'll see a Candida albicans infection of vaginitis. Trichomonas vaginalis, it's a common biota that can be sexually transmitted. Gardnerella vaginalis is a frequent cause of vaginosis, and it's again caused by that imbalance in normal flora. So pathogenesis. We have good bacteria in that area that kind of keep things in balance. But when it's overtaken in number by other bacteria and that balance is interrupted, it can lead to an infection. It can also be passed via sexual contact. So how do we treat it? Well, you can treat it with antibiotics. Generally, we're talking about topical antibiotics. It can work very well to treat vaginitis and vaginosis. Prevention. Safe sex practices might minimize this, but other factors are also still associated with it, and they're not necessarily clearly defined, which means that they're kind of harder to prevent. So that's Candida albicans, that's Trichomonas vaginalis, this is Gardnerella vaginalis. So yeast infection symptoms include itching, pain during urination, burning pain, flaky discharge, and usually the labia will be red and swollen and painful.